all aware, the introduction of the integrated data infrastructure and the advances of big data have been a huge benefit for health researchers. However, they also come along with a set of government attitudes to data, which I think should concern us all. Back in 1910, when the first census legislation was passed in New Zealand, one of the things we did here that they weren't doing in Britain was that we demanded that all census forms be destroyed. So we come from a culture with a concern about data and who has it and what it's used for. At the moment, New Zealanders seem to have forgotten that concern and forgotten the bad outcomes. But what we see, and what Brenda Pilott, who is the chair of the Social Service Agency's Collective ComVoices, is going to talk to us about, is some of the attempts, one of the attempts that is being made, was being made, it's been temporarily stopped. We think temporarily because the government has come back and back again with other attempts to collect or use data in ways that are intrusive to those who are using our social services. I'd like to introduce Brenda now. Over to you.
Thank you, Heather, and good afternoon, everyone. I hope you're all going to manage to distract yourselves from your iPhones and the British election results for half an hour or so. I know I shall be tuning back in with a lot of interest, as you may tell from my accent. I'm a South Londoner, so I've got a lot of interest in what Greenwich is going to do. It had better stay Labour, it always has been. As Heather said, I'm the chair of ComVoices, which is an aggregation, sort of voluntary association of the main national organisations in the social services. And in my day job, I'm the manager of social service providers Aotearoa, which is an umbrella group for community organisations that largely contract with MSD to deliver child and family services and community services. Just winding back a bit, I was for 10 years the head of the PSA and represented public servants, and before that, going back further, I was senior public servant at then the Department of Child, Youth and Family Services, the immediate predecessor of Oranga Tamariki. So I've been around this issue for quite a long time, so I'm really happy to have the invitation to talk to you because I think it's a really good thing for social services and health people to connect up. We don't talk actually enough, I think, together. So great to be here today. So what I'm going to do today is to talk about, firstly, what MSD were originally proposing to do. As Hera said, it's been temporarily halted. So I'll give you a sense of where things are at now. I want to talk a bit about what the big data landscape looks like from my perspective. And in particular, I want to spend most of my time talking about the issues that are associated with the government collection of data on individuals, both for those individuals and for the community organisations that are working with children and families and adults. So MSD back in September last year introduced for a small number of contracts, mostly the budgeting services, but also social workers in schools and family start, a contractual requirement that the organisations in exchange for getting a contract, in exchange for funding, had to collect and hand over a series of pieces of personal information about those individuals that they were working with. And this is a new requirement. We'd always reported aggregate data, the number of clients, the number of counselling visits or social work hours or whatever was in the contract, but had never had any requirement to hand over personal data about people, identifiable data, and that's really the sticking point. So I'm not sure how clear that is, so I'll just quickly kind of mention the things that are there. Firstly, there's a bunch of demographic data, so the name, the date of birth, the address, ethnicity, iwi, where that's relevant, and country of birth. That's a strange one. The number of dependents and the date of birth of the youngest dependent child. And then some service information, so the name of the service and the start and end dates and who referred that individual to that particular service. And the deal about that from our point of view, and one of the things that made it feel so bad was that it was, quite a coercive contractual requirement. In other words, if you don't hand over data, you won't get funding. And this was introduced, that take it or leave it approach was introduced, frankly, without any consultation and any discussion about it. It was very much take it or leave it. So the potential there was for that particular requirement to affect hundreds and thousands of New Zealand citizens. So anybody seeking advice from an agency that gets some funding from MSD. So that's everything from some of the very specialised services like the Youth Horizons Trust, Barnardo's, Family Work, some of those really big agencies, through things like Women's Refuge, sexual violence services, budgeting services, public education programs, counselling services, you name it. If you think of the kind of range of organisations that people, in most cases, voluntarily seek help from, that's who we're talking about. So all of those people, there's no information I've ever seen that says how many people, but I'm assuming that it's a significant proportion of the population. And of course, all of those agencies that get funding from MSD for providing services, and there are currently over 600 providers that are currently contracted by MSD. So that sparked really widespread and significant concern across the community services sector. And a number of professional bodies whose people work in those agencies also expressed quite significant concerns. So social workers, psychotherapists, psychologists, counsellors were some of the more prominent ones who felt there was quite significant problems. And eventually the Privacy Commissioner also chimed in with an inquiry, but we'll come to that. So one of the most fundamental problems we had with that, aside from the sheer irritation of MSD imposing such a requirement without any kind of discussion, negotiation, let alone funding, was that we could not see that gathering what one would have to describe as administrative data on individuals. The government felt that they were doing that in order to improve services. Now, we eventually, after something like 6 months, obtained a bunch of papers under the Official Information Act, and we combed through that pile of documents, yay high, to see what was it they were trying to do. Why did they want this information, assuming there must have been some reason for it? And we could find nothing that felt like a program logic or theory of change. There was no rationale for it that I could see, and I'm used to working in this kind of area, and I could see nothing that would tell me that gathering up that kind of administrative data would lead you to a result that says these services are effective for this person or these groups of people. There was no rationale for it that made any sense at all. Just a lot of assertions. One of the problems about that, of course, is if you don't know what the data is being used for, you cannot really obtain consent, because you have to be able to explain to the individuals concerned whose data is being used, this is the reason why we want the data and we're going to pass it on. If you don't have that, you really can't do that. So, we felt on a policy level it failed. It didn't work as a policy idea. And we all understand that both government and service providers need information. We all want to know what an effective service looks like. Nobody wants to be feeling like they're wasting their time. As taxpayers, we all want to know that our money is being spent wisely. There's no issues about that at all. But the main problem we had with all of this is that we thought it would tell MSD a whole lot of things they actually don't need to know, and relatively little that they do need to know. And there's a whole lot of issues around privacy, the purpose of the information, the level of risk involved in information washing backwards and forwards, and a whole series of ethical concerns. So, we thought about it from the point of view of citizens. So if you're somebody who's going to a community organisation, you're self-referred, you've not been sent there by any government agency, you've got some problem in your life or in your family, so you go along, say, to a counselling service. One of the things that would have arisen out of this is that your details then go into a database of vulnerable people. Your children will be in that database too. You'll be part of a risk profiling exercise. You won't know how long the data will be held because MSD didn't have a clue about that. You don't know exactly what it's going to be used for, and you don't know who's going to see it. And of course, you're sending your information off to MSD, and there's a pretty high degree of concern about MSD's ability to manage data safely and carefully. We know about the kiosk hacking thing. We know about the previous minister who used personal details for political reasons. And while those are, a while ago, people sort of do hold those views. We know that information on children in care was released wrongly to a group of people. And of course, recently there's been a security breach in the system that was set up to receive this information. And an independent review published a couple of weeks back just showed frankly, almost a comedy of errors in how not to handle sensitive data securely. So confidence in MSD as a guardian of sensitive information is pretty low. So that's one set of problems. For the organisations that are involved with this, there's another set of problems. Some of them are about the services that we deliver, and the sense of confidentiality that you can come to us, it will be confidential, we'll deal with your concerns in an ethical and confidential way, is a bedrock really of the kinds of services we're talking about. A very strong concern was expressed, and there's some early evidence that was well founded, that the intention to pass on personal information to MSD would have a considerable deterrent effect on people seeking help. And most of us would think that voluntary help seeking is a good thing, and that people who seek help from a community organisation at an early stage, that's a good thing. We would want to encourage it. And some of the early signs from the budget services and some other organisations that actually sampled some of their members, some of their clients rather, to find out how they felt about this, indicated that there was a high level of concern, and that the likelihood was that many people would refuse consent, or in many cases wouldn't go there at all. And of course, some people just don't want MSD or any government agency to hold information about them, and they have a right to privacy. And we all have issues in our lives that we don't necessarily want a bunch of MSD data analysts knowing about. So we were all very concerned that the people who may need help most may not seek it as a result of that. For providers, of course, there was another whole set of, if you like, administrative issues around all of this. Firstly, the issue that I've already mentioned, the idea that if you don't provide the data, you won't get a contract. And if that's not coercion, I don't know what is. That you would get less funding if you could only provide information on, say, 50% of the people that you're contracted to provide services to. And of course, the compliance costs for providers is very considerable. There's a whole lot of things that people would need to do around their own data systems, around their practice, the way consent is formulated and is sought, training for frontline staff, really, a whole lot of work around that, all of which was going to cost a lot of time, effort and money, and for which no funding was going to be forthcoming. So, we keep circling back to this issue around coercion, and I've got a quote here from an MSD report to the then Associate Minister of Social Development, Joe Goodhue, back in March 2016, so over a year ago now. So the warning was given by MSD in, I think, slightly odd language here, and they're drawing to the Minister's attention that the ability to decline service to a potential customer because they will not consent to sharing information potentially reflects the tensions between informed consent and coercive consent. Now, I have a lot of issues about the idea of a thing called coercive consent, and try that one in a rape trial and see how you get on. But I do think it does kind of indicate that MSD at least were aware that there were going to be issues around coercion. They advised ministers about this, but it didn't really seem to make much impact on ministers' determination to plough ahead with this particular requirement. And I've just put up here a few quotes about what some of my member organisations said about this. They talked about, the most hard-to-reach families not seeking help, privacy and confidentiality being the basis of the work they do, and noting that for any individuals that information about themselves and why they are at a particular agency is both sensitive and private to them, and that there's a level of risk people feel in providing identifiable data to government agencies. So this was all tracking along with a 1st of July this year implementation date. And in the meantime, the Privacy Commissioner instituted an investigation into what MSD were planning to do. And the Privacy Commissioner, John Edward, released a report at the beginning of April, which was, I think, highly critical of MSD. In fact, I would describe it as quite a damning report. And he used the term excessive and disproportionate for what MSD was proposing to do. And it's worth, if you haven't seen it, having a look at the Privacy Commissioner's report. The executive summary is a pretty good one if you don't want to plough through the whole thing. But it is, I think, a really useful reminder to people about it. And just by the by, there was a huge amount of input from NGOs. The Privacy Commissioner had 548 submissions from NGOs. So I think that indicates, the widespread concern about it. It wasn't just people like me sounding off. This was very, very widespread from both NGOs and professional organisations. So the Privacy Commissioner came up with 4 recommendations. That MSD should consider alternative means to get the information they were looking for. And I think in particular he pointed to the IDI as being a good source of getting useful information about service effectiveness and service use. He said that any system should ensure that people were not deterred from help seeking, and that MSD needed specific, relevant and clear reasons to collect the data, and they had not been able to provide them to this point, and that robust security procedures were needed. So, as I say, a very critical report, and while it was received with a lot of enthusiasm on the community side, the fact is that, of course, you then run into the limitations of the Privacy Commissioner's role. He has no mandate to tell other organisations, to tell government departments, let alone ministers, what to do. And, this wasn't a matter of the law being broken, but of just very bad practice. And so it didn't in itself stop the government going ahead. What did stop the government going ahead was the report into the security breach in the system that MSD had set up to gather data. And that became known publicly and around the same time as the Privacy Commissioner's report, and I think gave the government the opportunity to change their mind about it without perhaps losing too much face. So the good news from our point of view is that MSD is not proceeding with data collection from July, but it's only on hold. So this hasn't gone away. Instead, the Social Investment Agency is now responsible for developing a system to gather a two-way flow of data between the social services sector and government. And I'll be working with them on that. I've actually just come from a meeting, literally just come from a meeting with the Social Investment Agency about how they're going to go about it. And the good news from our point of view is that they'll be working with NGOs, they'll be working with the Privacy Commissioner, they'll be working with Statistics New Zealand and others who actually know this stuff and know what they're doing. So while all the issues are going to still need to be canvassed, our feeling is that now there's a better opportunity to have that discussion in a meaningful way with people who, to be blunt, know what they're doing. So we have still got some big challenges ahead. So all of those issues that I've mentioned still need to be worked through. The reason why we're doing it, all those privacy and ethics issues, security protocols, compliance costs. The statement that came out about this said that the system that's being designed by the Social Investment Agency is intended for the wider social sector. And I have a question in my mind about what does that mean for the health sector? We know that the IDI is a place where a lot of health information is going into and is being very well and successfully used. So at least that's my impression. You might correct me. But we're not sure to what extent it's intended to kind of create a different kind of database. As well as or as part of the IDI, we don't know. We really don't know that yet, but it's all up for grabs. And there are three other issues that I wanted to talk about, and I'll just move ahead to those. One is about the community mandate, so where are citizens in all of this? I want to talk briefly about the social investment agenda, because this is a key part of it, and generally just about the impact all of this stuff has on NGOs. So I don't expect you to read that, but we did a bit of a quick whiteboard exercise about all the stuff that's going on that we know about around the big data area. So just to make it a little more readable, this is kind of a list of all the things that are underway, as it says there. It's meant to say underway. So the Social Investment Unit, the IDI, the Data Futures work, Data Commons, which is an interesting piece of work. DIA's got a particular role as the government lead on IT and information. And then, of course, you've got agencies like Superu, Treasury, and, of course, the NGO sector. So there's a lot of stuff going on. It's a very live space at the moment. It's quite hard to get into from an NGO point of view. And one of the things that strikes me most forcibly about all of this is where's the citizen in all of this? And how is that mandate obtained for how government collects and uses data? The Data Futures work is meant to be leading the discussion with citizens about data. So they talk about social license. And, that work is ongoing, and I think we're kind of interested to see how that plays out. And it always feels like the voice of the citizen has to be kind of moderated through intermediaries. And I think, government needs to get its head around how they can actually have some direct discussion with citizens about all of this. What have I done? Next, I wanted briefly to talk about social investment. So the client level data issue is an intrinsic part of the government's social investment strategy. And for many people, of course, it was the first thing they'd actually heard and seen of it, which is not probably the best bit of marketing for a government social policy that you could come across. But we know that it's a very strongly held view and a key strategy for the government. We know that the now Prime Minister was one of the authors of the social investment strategy, so we're expecting that it's not going to go away anytime soon. And I think there's a few comments I wanted to make about social investment. Firstly, I'm not opposed to it entirely, far from it. There's a whole lot of things that make good sense about it. It makes sense to spend early as problems emerge, rather than spending later when problems have become more serious and more entrenched. And aside from the financial point of view, of course, it's easier to deal with things and better to deal with things early before they get more serious. And secondly, people's problems don't occur in neat departmental boxes. So the idea that there will be some mechanisms to enable cross-sector spending makes a lot of sense to me too. So, you know, there are some good things about it. But there are some things that I think that are quite worrying about the social investment strategy. And one of the most worrying things from my point of view is the use of predictive risk modelling and the role that actuaries are playing in social policy these days. And I'll be really interested to hear from any of you who've got some views on that. I think I have a quite a strong level of concern about it. You know, there are a whole bunch of ethical and privacy issues around all of that. I think the other real concern we have about this whole strategy is that the language around it feels like it's primarily about targeting and rationing services. So I think on the one hand, we've had generations of delivery of services that have universal provision and broad-based provision at their core. And it feels like the social investment strategy is moving us into an era where services are going to be much more narrowly available. They're going to be available state-funded only to a shrinking number of people and families. And one of the issues you see about what MSD was trying to do is that if you start to track people's service use, it's a very short step from that to saying, well, you've been to 3 services already this year, you've had your ration of government funding, you're done. Or you've been back to this Men Stopping Violence service 3 times and you haven't solved your problem yet. So therefore those services are ineffective, which is a very kind of heavy-handed way of looking at the way people change behaviour and the way services are delivered. But all of those things, I think, are potential outcomes of an environment where we are increasingly narrowing our focus onto fewer and fewer people and looking at rationing our services across an increasingly small population. And I think, as you know, I imagine that as public health professionals, you might have some concerns about what all of that means. So, you know, that for me is one of the most serious issues at a kind of policy level. And it also, this whole issue has thrown up some quite important challenges, I think, for the community sector. And this is just the last slide that I wanted to briefly talk to before we have time for some questions. One of the issues here was the assumption of MSD that we would, as community organisations, autonomous from government, become data collectors for them. And it's a very short step from that before you start to see community agencies as essentially an arm of the state. You've already got, I think, some real challenges there when community organisations have kind of brought the language of provision of service to government, and for many organisations their sole reason is to be service deliverers for government on contract. So this is outsourced services that would at one time have been delivered by the core public service and are now being delivered by what you might call community agencies. And at that point, the difference between a for-profit and a not-for-profit organisation starts to disappear. And if you look into the sort of disability and home support area, you'll see that distinction has kind of blurred quite substantially, and it's really hard to tell actually who's a for-profit and who's a not-for-profit provider in that area. You know, it's introducing, I guess, language that is to do with the market, and you get I think a very uneasy dialogue really between government and community when the government feels that their job is to direct how the community shapes itself and how it delivers things. So Oranga Tamariki began operation quite recently, and there's a whole chunk of that agency that's called market building. So here we have the Primary Child Protection and Community Agency, who has a function in their view of shaping the market for community delivery of services. And I think there are some significant and enormous challenges in all of that. And I think to some extent that's a real challenge for the community sector. Many organisations have bought in, I would suggest, to that language of the market, and that's a survival mechanism. But I think it's some short-term thinking, and I think we are about to enter into a period of really challenging discussion about what is the role of community organisations, and to what extent are we happy for government to say this is how we want the community sector to be shaped, versus what you might call a community-led development model. And I think, you know, that's an important and quite difficult challenge, and one that we're going to be thinking about. So that's the presentation. So I'm really happy to take some questions.
Thank you very much for that very interesting discussion. Do we have some questions? Neville.
Thanks very much. That's a really good.
Sorry, we have to wait for the microphone. I've been told to emphasise this.
I'm just going to get the thank you. Thanks very much. That's a really interesting overview of your sector. And I must say it's one process and actually one disastrously done bad example by the ministry that's really struggling to do a lot of things. Including provide social development, which is its core name. Okay, so I just wanted to talk, so as everybody could see, in particular, sorry, I'm Neville and I'm a statistician with Public Health and the Healthy Housing Research Group, and I'm in a row of 5 statisticians here, and we all use the IDI. So this is probably one of the biggest gatherings in the country of the statisticians on the IDI. There's actually not that many of them. But thanks very much. We're really interested in your point of view, and it's really good to hear that. Because there's a huge potential here. Big data is a tool. It can be used for good and for bad. This is clearly an example of bad. Preventive risk modelings that I've been asked to review for 5 years at various times by MSD. I've started off each time they've asked me to review it with, you know, I hate the idea of this. And my review was built from there. So just to give you some background, because it is the situations they wish to use it and the context are all important. And that's what you know about. I just want to talk about, because I'm one of the people, I think, probably leading, trying to bring social data and social service data onto the IDI. And what we've done, and the process was for homelessness, as the Housing Research Group, we think housing is part of the solution to homelessness.
It's a novel idea.
Well, MSD seems sure it's more motels at the moment. But anyway, so for Auckland City Mission data, which is the only NGO data up on the main IDI at the moment, they did a forum for all their clients. They had a hui, invited them along, talked about the process and what they wanted to do with the data and how they wanted to evaluate and look at, because housing's a really long-term, expensive upfront thing, but it has a huge long-term benefit, we think. And in order to capture that, we do need the big data. We need to look at health 10 years down the line. We need to look at the education of children. Is that better in houses or in cars? Is it easier to study? I have my opinion.
We're evaluating that question.
Yes, yeah. Well, we actually need evidence for how much. We need to convince Treasury to spend on social development. I really wonder, when I saw this example come out and play out in the media, whether it's a conspiracy or just incompetence to do it. But anyway, so to do in the homeless example,
I'd vote for incompetence on this one.
Okay. And that, I suspect you're right. I'd agree with you. But there is real benefits to be had in big data and doing it right. And it's about talking to the clients. Actually, people don't have, when we've talked to people, if it's done right, if the ownership is there and the ownership is based on the individual, the trust in the people who are in charge of the data is done right, and the oversight is right, you can get the social license to use this. And so for the Auckland City Mission data that's on the IDI, it's all de-identified. I use that data, but I have no idea of any of their clients. All I get is how it links up with other pieces of data. When I do it, when I work on that data, I have to do so in a secure lab that's swipe card access only. I have to get all my projects pre-approved by both Auckland City Mission and Statistics New Zealand and any other agency I want to link the data with. I have to, there's 5 Ps. Yes, I have to get ethics approval from us and go through the university on top of our, there is quite a lot of forms and it's done, but that's done because it's the right thing to do. And it is possible to do this correctly.
Because I've got a question for you.
Sorry, where I'm getting to is, if the government isn't going to lead in this, and if they're not going to lead correctly, how do we get the NGO sector to lead and to lead?
Well, I mean, I think they are going to lead. I mean, nobody but them can actually, I think. And you know, I have a bit more confidence in stats, and you know, we'll see. We don't know the Social Investment Agency yet, but there are good folk working there, and you know, they're saying some things that I think are much more promising. I think it's extraordinarily unfortunate that this has been the first kind of real exposure people have had, and you know, the trust and confidence is such an important part of it. One of the things I'm just wondering about from what you've been saying is you're talking about ethics approval, and that's kind of for you as a researcher. That information has got to have the consent of the individual as well, and those two things have kind of got to marry up, haven't they? And you're quite right that you can put things to people positively and probably, you know, get their kind of consent for their information to be shared, or you can do it quite negatively and you won't get it. But so there's a lot of work to be done, I think, around that issue of individual consent, and that for practitioners is a really important issue, because the first conversation you have with the person has got to actually kind of, you know, canvas some of that. And you know, I think it makes that therapeutic relationship quite a difficult one. So we've got a lot of work to do on consent.
Yeah, I've done it with the People's Project in Hamilton, where we talked about it, what we were trying to achieve, and we got individual consent from everybody as they went in, or we got them to sign individual consent.
Yeah. Can we talk further?
Yeah.
Wait behind. We'll exchange cards.
Thanks. My name's Dr. Angela Ballantyne. I teach research ethics and sit on one of the HDECs. For me, one of the real challenges in this space is around consent, and I think using a kind of clinical research model, consent's really important. But one of the things that struck me so much from your talk was that so many of the ethical issues, the privacy review, the risk analysis, all depends on the purpose for which they want the data. And that's the absolute hub of this, is we have no idea what the purpose was. And you can't do any of those other analyses without that. But one of the challenges with data is that the space is moving so quickly that once you've collected the data, what you're going to be able to do in 5 years, 10 years, 20 years isn't even foreseeable now. So I think if we're using a consent model, that's only ever going to get us so far.
Yeah.
Because one of the goals is to collect the data and use it in the future. Yeah. So I think kind of oversight models, ethics review models where you go back to some of the agencies and engage with them are going to be really key parts of the kind of governance structure, because I just think we can't put too much emphasis on consent, because it's always going to be so thin when you're trying to explain what potential future uses are going to be.
Yeah. And that, you know, that kind of takes us into the challenge really for practitioners working with individuals and families, where the consent for sharing information has got to be, you've got to have that conversation, and marrying that up with, if you like, the researcher perspective, I think it's just a really important dialogue to have.
Hi, I'm Louise Delaney, also here at the University Department of Public Health. Mine isn't really a question, I'm afraid, but it is a kind of a comment and a bit of a plea, really. I feel that we do run the risk of getting a bit confused between projects which do include identifiable people, identifiable to the analysts and the providers of services, the funders of services, and those projects which depend on de-identified information. And for me, I mean, I know there are possibilities of de-identifying de-unidentifying, re-identifying, that's the right word, thank you, Angela. But nevertheless, I think the issues are very different. And so, partly in response to Angela's question about consent, for me, issues about consent are a bit different from information which is absolutely going to be non-identifiable. And you can make information non-identifiable forever, i.e. you can't ever reclaim that link. So that is possible. And I think that is, so I think it's really important when we talk about these projects about data to make it clear whether we are talking about totally identifiable, de-identifiable, and de-identifiable which can never be reclaimed as identifiable information. And issues about consent are different. And I just think if we could, you know, when we talk about these different kinds of data sets, if we try and remember which sort of data we are talking about.
Thanks.
I think we've got a question up here. Sorry guys, it's getting toward being a bit late, so if anyone feels that they need to leave, please do so. But the rest of us will keep talking for a bit longer.
Hi, I'm Maria Stuber. I'm based here at Otago, Wellington as well. Partly a comment and partly a question, really. Within sort of university-based research, we do have very strong, and health research in particular, very strong requirements for ethical overview. You know, this is something which is, you know, far less well developed in other areas of social sector research. But one of the issues that we do face quite often within, you know, I sit on the University Health Ethics Committee, is where is the line between audit of services which is required as part of the, you know, proper functioning of a service and research. And, you know, it can be quite a grey area. And so I guess my question is with, you know, I mean, whether it's the preventive risk strategy of the MSD or many other kinds of analytic work that go on as a routine sort of daily activity in many government agencies, where do they draw the line, if they do at all, between research and operational you know, monitoring and audit?
Well, that's a good question. I mean, all of the organisations that will be involved with this routinely report quite a lot of data, both qualitative and quantitative, in usually 6 monthly and annual reports to MSD. And there's a whole lot of narrative information, which, as far as any of us know, nobody ever reads. And there's, you know, lots of really good stuff in there actually about what's happening. And as well, they are audited in a range of ways as part of the accreditation process and so on. So there's a whole series of ways to for organisations to be accountable for their delivery. I think one of the things that was kind of interesting in all of this was that there was quite a disparaging kind of response from who was then Bill English, who was Minister of Finance at the time, now Prime Minister, when I suggested to him in a public forum that actually if you wanted to know about service effectiveness, you were probably looking more in the direction of research and evaluation rather than gathering up this kind of data, and he was extraordinarily dismissive of it. Really, you know, we don't have time for that kind of stuff. It takes too long. It doesn't tell you what you want to know. So I was, you know, kind of concerned that they were putting quite a lot of eggs in one basket, really. And I think there's not a well-developed overall learning system around the social services area. There's been quite a heavy monitoring framework, which a lot of providers find relatively onerous for little return. This felt like just more of the same, really, rather than something that said, what is it we all need to learn and how can we develop a system that allows us to do that? So I think there's not a resistance to having that, but simply no mechanism really at this point for doing it. We're hoping that some good might start to come out of this, though, after a bad start.
I'd just like to ask a chair's question. I'm interested in your last slide and talking about the market building approach and market language. And Neville's talking about housing first and homelessness and research into homelessness. Well, I mean, there's another approach to homelessness, isn't there? That we have a government that believes in providing housing for all New Zealanders. And we don't need the data on homeless people. We don't need their intrusive details about their lives, whether they're de-identified or not. Because my understanding is that in all of these approaches, the predictive modelling and so on, really we are talking about coercive consent. There has been no willingness on the part of government to suggest that people should have the right to refuse to give their data and still be provided with services in a decent and civil fashion. And I say decent and civil because I'm referring to the way in which WINS treats people, in which people who need services are increasingly expected to endure.
I'll tell you what Bill English said when I asked him about that, and the very same thing that I was just referring to, and said, well, why would people need to hand over their information to government? And he said, if they want to access publicly funded services, they have to hand over their information. That's the social contract.
Okay, I think
It's not my idea of what the social contract is, nor in fact Rousseau's, I suspect, but that is kind of the world we're in. And, you know, I actually think the other part of the answer, though, is in the balance between universal provision and a sense that, you know, all of us, you know, we should have widespread access to services versus this highly targeted thing. That, in my view, is probably one of the most important issues around all of this. A big discussion to have.
Okay, good point to finish. Thank you very much for coming along.
Pleasure. Thanks for the discussion.
And I'd just like to say what a wonderful